Okay, we're going to restart again. I just want to thank the choir from Ballymote again. They were excellent. I think everybody really enjoyed that after our lunch. So our next speaker is Jackie Austin. Jackie is a Director of Public Health Nursing in Dublin North Central. She has a particular interest in child welfare and early intervention and has completed an MSc in Child Protection and Welfare in Trinity College Dublin. She's worked for many years in Traveller Health in Dublin South West, and she's a keen sense of the importance of respect, equity, partnership and collaborative working across communities and services. And she believes that the best solutions for the provision of appropriate health services for populations often stem from great initiatives set up by our frontline teams working together. So I'd like to introduce Jackie.
And I suppose I'll start by saying there's no pressure after this morning. My goodness, it was fantastic. It was really amazing. Thank you so much for the presentations, because I'm glad I left mine a little bit loose, because I could have gone down any different direction and would have been crossing over a little bit. But so I suppose I'm going to speak to you now about I suppose from a public health nursing perspective, what we find in homelessness, etc. I have three messages, really, but I'll come back to that in a second. Everyone so far has spoken about it takes a village to raise a child. And I remember meeting Geoffrey Shannon in Trinity one day, and he said to us, it might take a village to raise a child, but it takes the interagency to keep that child safe. And I thought that was brilliant, and I thought he should actually coin it and use it. It was very good. Geoffrey Shannon was the person who said that, not me. Okay, so I suppose I'm going to move on. Apologies now, a bit nervous after everything. And just a bit of context here, that just, the UN Committee on the Rights of the Child required that the states to take all possible measures to improve perinatal care for mothers and babies, to reduce infant and child mortality, as well as create conditions that promote the well-being of all young children during the critical phases of their lives. And again, I think that's a real grounding after listening to everything this morning. I know some people know this slide, they've seen it before, because I took this picture in Rome last year, and just outside the columns, you see the columns there, you have rows of people living in tents, and I just thought that was really interesting, because beside it you have that new sculpture, I think it was put there in 2018, a sculpture for migrant populations, and you see children and families in it, and then outside that. Anyway, I'll say no more about that, because I was there again this year and they were all gone, but it was mass time, I think, so that might have been why, because they were somewhere else. Anyway. Okay, so a background to what we do as well. I think I've always been very interested in, that document, Better Outcomes, Brighter Futures, and then the first 5. And our maternity strategy as well, all very, very important. And I can't read from this, I have to read from this, apologies. Women and babies have access to safe, high-quality care in a setting that is most appropriate to their needs. Women and families are placed at the centre of all services and are treated with dignity, respect and compassion. Parents are supported before, during and after pregnancy to allow them to give their children the best possible start in life. Again, I don't think we can get better than that. It's a really important statement that I would use regularly. So, I'm moving on now to talk about why we're here. Why I'm here. And I did question that, I think, initially when I was asked to speak. I said, why should I be here? And then I looked at this and thought, well, of course we should be here, because there are 54,000 children, 54,678 babies born in 2023. 98% were visited within 72 hours of discharge from the maternity services, regardless of where they live. And that's by public health nursing. So we would see every baby that's born in this country within 72 hours of discharge from a maternity service. And I think that's really amazing. And it's a really important service. It's, it's such a valuable valuable time. And the whole concept of everyone has a public health nurse. And we have, if you think about it, all of you in here have access to a public health nurse at some stage in your life. I know you spoke about older age. We have plenty of older people that we see every day as well. So we're right across the spectrum seeing everyone. And then I'm going to say maternal health, postnatal services. We now see mothers, and we have a standard for mothers up to 3 months of 3 months postpartum under the National Healthy Childhood Programme. And child development screening assessments. We have five core visits that we have. I usually have lots more slides on these, but I've cut everything for this presentation just to be clear. And we make every contact count. Now, having said that, 5 core visits. I've just been off the phone to one of my public health nurses out in the corridor earlier on about a case that we had a couple of weeks ago. It's always on a Friday. Public health nurses will agree with me. You know, there's always a crisis on a Friday, usually Friday afternoon. This happened to be Friday morning. And one of our nurses was expected to go to court, and we had to take the case notes and write up a report very quickly. And when we went through the chart, we noticed that this baby was 3 months old, and the public health nurse had seen that child or had contact with the mother and seen the child up to 20 times in that 3 months. And again, we have 5 core visits, but sometimes if you look at some of the child health records and just go through them for the first year of life, it's amazing what you'll find, that contact that we have. So that's why we're here, that's why I'm here. I listened to Mark Bella speaking recently, and thank you for what you said earlier on, ACEs. I think it's really important. I had 3 points that I wanted to make today. One of them was the importance of early intervention, of that mother and child piece, which I'll talk about in a second. The importance of adversity, which we have already from both, and then the importance of the public health nurse, and I think I've got that across. All right. So, the next slide. I think this is really important. It's again Marmot, and it's the foundations of virtually every aspect of human development, physical, intellectual, and emotional, are laid down in early childhood. And really, you know, the importance of infant mental health and perinatal mental health, it really is so significant. Does this shine on here? Does it not? No. Does that work across here? It's not for me. Anyway, never mind. The interaction, if you look at that mother and baby, that contact between mother and baby, and how vitally important that is. That baby's brain is developing every second, every time, you know, that there's an interaction, there's a development in the brain, and it is so important to really, you know, build those foundations for mother and baby. And it's that perfect opportunity, isn't it? And when I say mother and baby, it's actually carer and baby as well, isn't it? It's that piece of that interaction that's happening between them. Now, I'm going to talk about this, I'm going to move on and talk about this in the context of homelessness. Okay. Can I just get a drink if you don't mind? Sorry, now I forgot my drink with me. Thank you. I think it's just here. Thanks, sorry. Apologies. So, building a response. I'm just going to talk about homelessness now. And thank you. Back in 2017, we were beginning to see a lot more families becoming homeless and exposed to homelessness. And we were finding that, you know, for public health nursing, every child has a child health record. And that child health record follows that child wherever they are. So if we have a child who's in Ballymun and they move to Sligo, that chart will follow the child. And I think that's a great service to have as well. It's really, really important. We were finding, and I was particularly finding, that you'd come into the health centre and there could be a pile of charts and no children. They were being sent, say somebody became homeless and they were in a hotel in Tala, so you'd find a chart. Even though there was no child, the child had moved on. They'd moved on significantly. And we were trying to find a solution, and it was difficult to do that. We had some very difficult experiences, and I think there was one in particular where there was a young child, a 10-year-old, with the mother and 2 other children younger, a baby. It's a baby of 3 months, I think, or whatever, no, a year-old, sorry. And that little 10-year-old had been suicidal, and that's how it came to our attention. But it came to our attention indirectly. It came to me from a GP in the city centre. So we said, this is it, we have to do something about this. We have to try and follow our children. So between ourselves in public health nursing in the south side and the team over here, the social inclusion team in Dublin North Central and the South Dublin County Council, we got together and came up with a plan as to how we could try and track our children. And it actually worked for us. It's still working today, though it's outgrown its, I suppose, capacity now. We have so many more children. But it was a joint, so we jointly worked together. We had a joint initiative where we had strategic planning between public health nurses, as I said, South Dublin County Council. We used the documents I spoke about earlier on brighter outcomes, better futures. The Nurture programme, of course, at the time, which now is the National Healthy Childhood programme, Children First documentation, etc. And then there was a number of Irish inquiries and reports, which I think are always very relevant. If anyone's here from public health nursing, they'll have heard me speak about them before at length, and the findings from them. But one of the findings that was really important for me was on the Monagher report, and that was Helen Buckley and O'Nolan, when they said that, and this was to do with the Monagher, if you remember the Monagher report, the evaluation and tracking and the movement of families and the management of records, that we really needed to look at that, okay? So that really guided us as well, okay? So I'm going to be going back and forth with my slides now. The next slide is literally, it's one of many slides in relation to this project that we had, how we would sit down and track. What we did was we sat down and we tracked what we were doing already. And in the Northeast, where we had the Homeless Helpline team, we were working very well together ourselves, tracking families. So we decided to write down what we were doing and use that across the city. So what happened as a result of that was the county councils and really led by the South Dublin County Council, got together with the DRHE and decided to let when DRHE had families that were in homelessness, they would let the social inclusion team. And that's how it's happening today. The DRHE will inform the social inclusion team of families who are becoming homeless, and the social inclusion team send that to us, and we send that out across the city. So when I say across the city, I mean from Bray up to Wicklow, and sometimes beyond, as I say, out to County Meath and sometimes County Louth. All right? And it works. Now, it works to a certain extent. What the idea is that the public health nurse in Tala is in contact with the public health nurse in the inner city, and they'll share the records or hold on to the records as the case may be. And it means that families, that we're not coming up with hundreds of charts sitting on a desk. Literally, at times, there were hundreds of charts. And I think we did a good job to try and address that. So, context on that. In January, sorry, I didn't put the rest of it up there. My apologies. That was just, I won't go through. I've given you that already. So, in January 2023, there were 1,163 families living in emergency accommodation just in the Dublin area. And that was a big increase from 2022 of 42%. And recently, I listened to a research launch from the DRHE, and it was looking at the homelessness in young people in in Dublin, in the Dublin region. From 18 to 24-year-old groups. And it was the stats would say that there were 383 children, young people in 2015 in homelessness. And then in 2023, you had 1,128 young people, which is an increase of 198%, which is incredible, really, isn't it? 52% male and 47% female, 47.9%. Now, I thought this piece was really important. I thought that 58% of all young adults in homeless accommodation are in family units, and the majority of those were female. So, and the reasons for entering homelessness were family breakdown, 30%. There was a range of different, but family breakdown was 34.7%, and overcrowding, 13%. Loss of notice of termination, 12%, and it moved down from there. And I suppose, it made me think of our young mothers and our families, and the fact that if you are a young person, if you're young and you become pregnant, there's a much higher chance that you're going to become homeless. And if you're a baby born to somebody, or you're a baby born to a young person, the incidence of homelessness increase. The threat of homelessness increases. And I think the family breakdown is often something we'll see as public health nurses. And I've seen that over the years, where, you go back to a home and it's broken down because there's yet another baby and a mother is becoming homeless. And we see that, we've seen that quite a bit. Okay, so a little bit more context about Dublin. So through our system that I was talking about, where we are notified of our families, in 2024, there were 664 families notified to our service. 1,101 children. This is just across Dublin, and this is on top of what's families who are already homeless. 201 were under the age of 1. How many caseloads is that actually that I'm talking about when I think about it in public health nursing terms? 703 are under the age of 5. And then 198 were over 5s. So 301 of these families, which is 45%, were accommodated in the North Inner City. Now that's anyone that knows the North Inner City. It's a small enough area, and it's exactly what Aoibhinn was talking about earlier on. It's just outside your doorstep that most of these children are living. And I think that's really, really important and really relevant. And in around that area too, on top of that, some of our public health nurses' caseloads, they will have 60 to 70% birth notifications into their caseload, born in homelessness. Now we have some caseloads have some of our public health nurses have a complete homeless they will look after most of the accommodations, but this will be an area where it's a mixed population, and the public health nurse, on top of families who become homelessness and on top of the 200 babies who are homeless, she will have 60 to 70% born into homelessness. That has relevance, of course, for the Rotunda Hospital as well. And then back up to, I'm just going to give you an example from another health centre, which is Ballymun. And in 2024, there were 286 CAFNAs where there was identified need. A CAFNA in public health nursing terms is a child and family health needs assessment where we identify risk early and where there's a need for early intervention. That's one health centre alone, okay? And I hope all the public health nurses stand there, you've done your training and you're using your CAFNAs. But it is to identify early need. And from that as well, you have, from those 120 of those children were living in IPAS accommodation. And I have to say, the public health nurses in Ballymun have done a lot of work. Like North Inner City, there's a lot happening there, and there's a lot of services, and people work very well together. But equally in Ballymun, we've had some, I suppose, worries and concerns over the last few months, where nutrition has become a problem, and we'd be referring into Aoibhinn. And they've worked very closely with IPAS and with different organisations to try and address issues, and it's worked very well. There's really good relationships with people, and good communication and good outcomes. We also did a snapshot of one day in North Dublin, and that's right across Dublin, to just see, and this was very much an underestimate, but just to see on a snapshot how many young children were living in alternative accommodation. And it was literally a snapshot, so I can tell you it's very much underestimated. So what we could count in one day was across the whole of the north side of the city, 800 children were identified. And I suppose, again, just on that, you have well over 50% of families living in the north side of the city, which I think is really important, okay? I'm going to move on now and give you some stats. Back again to 2019, when we had started our tracking system, we looked at trying to see what were the, we decided we'd audit our charts to see if we could track all our children, if we could do that. So we took an audit from 91 children under the age of 4 in the west side, in Dublin West. And at that stage, 32 records we audited, and we were actually really delighted with the outcome. We found all of those charts straight away. Within 2 phone calls, we had everything we needed, which meant our project was working. The results, I think, are very interesting. 81% developmental assessments were up to date, which is really good to know. could be better, but that wasn't so bad. 59% were reaching the age-appropriate milestones. I'll come back to that in a few minutes. 56% were referred to primary care. 28% were referred to other services, which was assessment of need, hospital, etc. There was 9% evidence of attending hospital. We felt this was a little bit underestimated because it was, while we might not always get the referrals back from hospitals at that time or GPs because of the movement. We hadn't everything in. That's why it's great to have somewhere like the Lynn Clinic to help us out with. 47, this preceded the Lynn Clinic. 47% were referred to family support, only 28% were referred to TUSLA, and 47% there was evidence of breastfeeding, which I think was really important, and particularly considering today as well. And 84% update on immunisations. Now, we're looking at this at the moment. This was never written up. It was an audit, and we got more from it than we ever thought we would get. But at the moment, we're now looking at our National Healthy Childhood Programme and our child health records that are being audited. And with Fiona Canty, who is a public health doctor, child health, public health, who is helping us with our audit of the charts, but looking at them in a little bit more detail to try and, because what we found in our results, we needed to do a little bit more. It was very much like what's the balance on that? What do we have to measure it against? So we're looking at that. So we may be looking further afield than our Dublin North to try and access more charts to get a better picture, because it's really difficult to know what's happening in a child's life. And I suppose I've always had some concerns about what is happening in child health. And the only stats that we have would be in relation to traveller health. And the fact that traveller children, traveller infants, are 3 to 4 times more likely to die in infancy than the general population, I think that's really not good enough. It's not good enough. That's the only stat I have in relation to vulnerability, but it is something that I said Fiona is looking at with us very much so, and good to have. No. So, a few other findings from that time. The majority of referrals that we had were at that particular piece were for sleep, toilet training, speech, baby massage, breastfeeding support, and weaning classes. And I think the same, we'll be looking at the same today, and it'll be interesting to see when we have our audit completed, our new audit. And then the results, these were the kind of things we weren't expecting to find, but it was every public health nurse wanted to tell us their story. Maternal health was something that came up significantly. Everyone highlighted maternal mental health. There were children who were living in a car seat, which I thought, again, was, I hope we're not having those experiences today, but I'm afraid we might be. We had torticollis and plagiocephaly from sitting in and, being left in buggies, etc. Developmental dysplasia of hips, so, trying to get the proper treatment for somebody who hasn't got enough room, very important. Challenges for feeding, weaning, hospital admissions for serious injuries. We didn't have a lot of hospital injuries, but they were for serious injuries. So, moving on. Now, we had a lot of talk about ACE, being ACE aware. I absolutely think we need to be really informed about ACE and understand what that's about. To be trauma informed, we need to know, we need to be there, we need to be to understand and really take it on board. To build resilience, we talked about resilience this morning. We need to talk to build resilience, and we need to be able to understand and be able to listen. I think that's really, really important. I could have focused on any of these today now, but I didn't, and I'm glad I didn't, because we had so much information beforehand. And I recently did a short program or a short module on restorative practice, and I'm sure there's some restorative practitioners here in the audience. I hope there are, because I think it's a really great way forward. But we talk about adversity, we talk about trauma, and I suppose my eyes were opened to shame, and I thought shame was something that was really important to think about. and the effects of poverty poverty can have on a child's life. And research will show that children living in poverty have lower levels of health and well-being, attain lower levels of education and lower levels of occupational attainment, and are more likely to be poor in adulthood, and we know that from this morning. But I suppose the reference to shame was something that I was really fascinated with. And, families, the deep toll taken, both physically and emotionally, particularly on their mental health and their well-being. That was Quinlan and Bulger on a piece of research that was done in Tala it was commissioned by CDI, I think, or taken by CDI, but commissioned by TUSLA, Many Hearts, No Homes. I think it's really worth a read. It's a really interesting piece of work, and it's done by photography. People go out, take the photographs of their lives and come back and speak about what's happening for them. And then in relation to adults, the adult homeless considered to be the adult homelessness, considered the external conditions of stigma on homelessness, and that was Martha. But for me, what I found was that the words that were used, but both by parents, by young mothers, and by adults on the street who are living homelessness, the similarities was incredible. Words like fear, these were the parents, or these were the adults. Fear, frustration, sadness, stress, confusion, worry, depression, loneliness, isolation, anger, insecurity, helplessness, feeling ignored, broken, disappointed, lost and traumatized by the experience of their homelessness. And then parents, similarly highlighting the physical health, mental health, and emotional worries that they experienced and that are likely to have an impact on their children. And they used the same words: sadness, stress, confusion, worry, fear, isolation, lost and broken. And again, I thought that was really, that really resonated, that a child in homelessness has the same inbuilt shame as an adult who's on the street. And, I think it's worth considering. I'm not too far from the end. I'm flying through this now. I had a lot more to say than I'm putting into this. Anyway, so back to the baby that I had earlier on. And I spoke to you about how important that interaction is between the mother and baby, and that bond that's happening between them. And if you think about all the things that happen to a mother, I feel sad, I feel so tired. A mother with a new baby, like the normal, I feel tired. If they're going to be exposed to homelessness, where am I going to live? What's going to happen when I leave here? I have to get the glasses. Will I be safe? Isn't that very interesting in the North Inner City, for example, or in direct provision? Am I safe where I'm going to be? Who's going to help me? I'm lonely. And we talked about resilience earlier on, and not that long ago, I had a young lady who I was talking to, and I knew her granny, I knew her mother, and I did her birth notification. She was 19, and so I'm a long-time a public health nurse. But she was 19, and she had a little 3-year-old, for example. And she had lost her mum early on in life, and her grandmother was her carer. She lost her aunts as well. They were all lost to suicide. This is all relevant to what we spoke about earlier on. She lost two aunts, and her mother to suicide. And then her granny was her main carer, and who was an amazing lady. And then, not that very long ago, her granny died. So she wound up in homelessness in the inner city with her little child. And she's resilient. She's well able to get by and manage. But when I was talking to her, she was crying. And I thought something terrible had happened. I thought it had really been a very difficult time for her, because things had happened, and I knew about some of them. But she said to me, I'm lonely. And it just stopped me in my tracks, because I thought we sometimes don't see all those other things. There's so much happening. There's so much going on in a mother's life that we don't actually see. We can't see that piece, that human piece. Of course she's lonely. She's 19 or 20 in the inner city, away from all her family, with a little child. Of course she's lonely. Why wouldn't she be? So anyway, keep going. I could go on, sorry now. So the next one is No one's listening. Again, it's really important that people are heard, that we hear them. Aveen talked about that earlier on today, about being listened to and about being heard. It really is important. Will they find me when I have a new baby? Will they know where to find me? Where am I going to be? Who can I trust? Okay. Now, if you think about this, and you think about that interaction between the mother and baby, and the more that happens, if you put drug addiction in here, if you put, and I didn't put them onto this, I just said I'd leave it at this. If you put drug addiction, if you put domestic violence, if you start looking at, all these other, like people being attacked or, mental health issues, significant mental health issues, what happens to that interaction between the mother and baby? Think about it if you had a fright. How are you if you have a fright? You're stunned, aren't you? So think about that for our mothers. The more that's happening for them, the harder it is. But they still do their absolute best. And I'm always amazed by the amount of people, and I could repeat some of what the examples of today, but mothers travelling halfway across the city to make sure those children get the absolute right schooling or extra support that they might be getting in another part of the city. And you'll see them travelling, over and back to schools. And I just think they're remarkable, some really remarkable women. But just be very mindful of this. I think it's really important to be mindful of where people are at and where you're at. Because sometimes you going in telling somebody what to do, giving them, here's this parenting class. For what? There's no way is somebody ready for that themselves at that particular stage. And yes, they are. Once they're settled, yes, they are. I'm delighted to have it at that stage. So I think it's really important to have that reciprocal relationship yourself with your client, but also to help that containment. Because sometimes a word, just to understand, to let somebody know that you understand what's happening for them, makes a world of difference. It's a little bit like an example, public health nurses will have heard me say this before. If you walk into a room or you walk up to ask somebody for some support or advice or something, and you come out feeling, what the hell, that was worse, you come out feeling worse. What was that about? As opposed to going in and asking someone for some help and you come out feeling better. What was that about? What was the same problem, but you come out with a different feeling. You feel better. So really important to be, in tune with your families. And I think respect is huge. Okay. So what is happening across the country or nationally? Some of the positive bits. The government has identified 6 areas of potential to make the most differences in children's lives. And I think you think about the role that we have in this and where we fit in. Income support and joblessness, early learning for children, the cost of education, family homelessness, service integration, participation in arts and culture. We had a lovely example of arts and culture today, didn't we? That's coming from the Department of the Government, or the Department of Taoiseach's office. And I think we certainly, I've highlighted there early learning and childcare. And I know in the North Inner City last year, we would have provided the National Healthy Childcare Scheme. You're very familiar with that, I'm sure. And we would have sent forward, I think, nearly 200 applications for extra support for children in childcare, which I think is really, really great, because that's coming from your CAFNAs and your identified need for early intervention and early support. Family homelessness, we're here today looking at congregated settings and family homelessness, and that's a great start. And, around the country, there's some great initiatives. Service integration, I think it's so important, service integration. And then, as I said, the participation in the arts. Now, I have this in the next slide. I probably oversaid what I was going to say. But, a national review of access to this is I'm responding to the national pieces here, putting them together. National review of access to the National Healthy Childhood Programme by Fiona Canty. She won't mind me having her name up here. Child Health, Public Health. I spoke at a conference with Abigail Collins about 2 years ago, where we highlighted some of our concerns in relation to child health and welfare, and particularly living in homeless accommodation and the outcomes. And as part of all of that, Abigail has, and the National Healthy Childhood Programme has, are investing time and energy into this area of access to the National Healthy Childhood Programme, and that is Fiona Canty. And if you don't know Fiona now, you will do in the future. I think I'm on about 11 different groups with her. I was just trying to count out. She really is trying to push forward. So everything we're saying here today will be connected, and she'll be looking at all of this with us, which is absolutely brilliant. Some of you will know her already, involved in nutritional programs, looking at access to appropriate nutrition, accommodation, SIDS, etc., etc., etc. So update public health nurse design and the ability to replicate. So the piece that we did, it would be good to be able to replicate that across the country. I think, again, Fiona's looking at that to see how feasible that is. I think working very closely with your county councils is very important. We have a very good relationship. Multi-agency approach is needed to address the complex needs of young children and families exposed to homelessness or displaced in our communities. So you have your Home Visiting Alliance. I'm sure some of you know about the National Home Visiting Alliance. It's happening now. So, it's, for example, if you have, as public health nurses, we will refer to other services such as family support, community families. I'm sure you have community families, brighter beginnings, etc. There's a lot of different services out there that we can use, and I think they're great examples. The community families is something that came from public health nursing and has been reviewed recently and is opening up across the country. It's a great model because it's really built around the National Healthy Childhood Programme as well, and very integrated. I'm involved in that as well, so I think it's a great model. And then a particular focus on early intervention. As I said, maternal and child-infant health is essential, and it needs to be recognised and prioritised as soon as possible. I think it's high time for a dedicated child health service, and that's where we should be really focusing all the time. And we really do want Ireland to be one of the best small countries in the world in which to grow up and raise a family. We actually have the bones, as far as I'm concerned, we have the bones of one of the best health services for children in the world. We just need to put a bit more money into it and a bit more, work together a little bit more to put, and focus on our child health and our early years. The next slide that I have is to say thank you very much. There are, if you're sharing the slides, there's a few clips on that. They come from Wales, actually, the Welsh model, and also Nadine Burke. I think I'm now going to play, if some of you might, there are, the CNME in Mayor Roscommon can't be here today. I think they were meant to be here today, but they couldn't make it. But I did say I would plug their work, because they've been working on podcasts recently. You'll probably all know about their podcasts from this part of the country. And they were looking at social inclusion and inclusion health. They've done a series already, but the second part, they've come up to Dublin, to us in the North Inner City, and recorded some of our teams, both from our clients and from our nurses and our workers, our people who work in social inclusion, and they've launched a second series of podcasts. We are going to listen to a short clip from an advertisement for it, actually, now in a few seconds. But I would really, after listening to everything today, I think the podcast will put everything into a perspective from us, because it's literally talking to mothers, it's talking to people who've been exposed to drug misuse and homelessness, and from our public health nurses. They do a walk around with both Clodagh Paula and Frances from our North Inner City. So I think that's all. I had loads more to say written down here, but I'm not going to say it now. I think I've said enough. And apologies for the slow start. I didn't take enough water. So thank you.
Our Inclusion Health podcast series.
In this series, we are focusing on the voices from the margins.
I was actually homeless, and I didn't have a medical card, so I couldn't see a doctor. And I could see a doctor if I had the money, but I didn't have the money because I was homeless. And when I did have the money, I was in addiction. So it was just very difficult.
When I came here and was trying to figure out how it all works and etc., what helped me is the beliefs that I had. Some of them is that I cannot give up. Another one is I promised to my husband that I have to live this life for two of us. And strong belief that like I managed once, so I can manage the second time once again.
In Roma community with mental health is very difficult because some of the Roma people, they are epileptic or they have mental stress, and for these things it's not easy to go to share this information because some of the Roma people, they don't have translator, and when they go to the hospital or they go to the MGP, they don't like to share this information.